Welcome. I'm Paolo Cassano. Welcome to the MGH brain-PBM clinic rounds. Today is October 4th, 2024. And it's my great pleasure to invite today Tom Kerber, who is CEO of SunPowerLED, to present on the subject of transcranial photobiomodulation in children with a traumatic brain injury. Also inviting Margaret Naeser, our frequent flyer here and our awesome consultant, to also contribute to this. Tom and Marnie, please take it away.
Okay, all right. So I just gonna, okay, there we go. All right, first of all, I want to thank everyone for allowing me to be here. It's a privilege, and thank you, Dr. Cassano, for opening this door for me. And hey, I see some folks I've now met personally. Hi, James, and Lou is there, and a few other people. So great stuff. So anyways, I'm going to have very shortly Margaret Naeser present her slides, but my background is 40 years of electronics. I was nicknamed the doc as a kid because I fixed everything. So that's my only doctorate, okay? But 40 years of electronic development. I've done all sorts of crazy electronic development, very advanced equipment. And if the space shuttle was still running, I probably could have some equipment on there too. But we've done, my experience now is the last 18 has been in the medical front, starting with dentists about 18 years ago, making the first high power blue light for the hardening of the white fillings. And we had that on the market competing against 3M. I wouldn't recommend trying to do that with anybody on this. That's a difficult thing. But we had our product out there. We got FDA registration in that, and we were hardening fillings with our blue light. It wasn't, if you would have told me that red light could be useful to shine on your arm, I would have, and get rid of pain, I would have told you, you must be smoking something. I could believe that light on, on a baby, blue light for the belly ribbon stuff, no problem. Using light to harden a filling material, right color, no problem. Using, that was 465 nanometer. Using light to photoactivate hardening compounds for auto body repair and glues, no problem. But shining light on a hip or a joint or something like that, that would have been, no, I can't believe that. So that's where I started. And about 15 years ago, I had met a doctor, a medical doctor, who thought outside the box. And just a little background is I fell off of a ladder about 35 years ago, second floor height, onto concrete. So I was constantly, every year, 2 years, I would have severe muscle spasms. And that's what I dealt with for 3, 4, 5 months. So, and then it would reoccur again, along the way. That was my situation. My wife was also having trouble with her thyroid. Thyroid was removed. She had all sorts of medical problems. And I sought out other medical attention to try and figure out what was going on with her. Little did I know, the very first meeting that I went to, the doctor was going over her records there and everything. And he said to her, he said, stress can cause also all sorts of problems. Is there any stress you can get rid of? And my wife immediately pointed at me because I'm self-employed, and the stuff that we've gone through, the difficult times, all that kind of stuff, lots and lots of stress. So the very first thing he asked is, what do I do? I said, well, I make this dental device for curing the filling. It's blue wavelength. And he said, can you make it in red? And I'm like, okay, well, why red? And he said, well, red's the right wavelength to photoactivate a drug that kills cancer, PDT. In this case, it was a drug that he had researched. he was very much into research, and he was going to go buy 10 red laser pointers, James, and put them together with elastic bands. And that he was going to do that, buy those things that day and start the treatments the next day. And I says, look, can you just give me 3 weeks? And I had a team of employees and all hands on deck. And 3 weeks later, we provided the first water-cooled high-power light. So we're talking, in this case, that has 1,000 high-power LEDs on it. We're looking at an optical power of 625 watts for those. So, and liquid cooled. And we needed that kind of, eventually we went to that kind of power so we could go much deeper into the body with the 635 nanometer wavelength. So that was what I developed there, but very early on. And we had success when I delivered the light. The next day he treated the 2 patients. I didn't know about all the regulatory stuff. So the drug was already approved in Canada for bladder cancer. So he felt he could use it off label. And he shrunk the cancers on the first 2 patients. So I thought for sure the world is going to open up for us in the cancer realm. I wished I could say that. It's been 15 years later and we've still been trying to move this forward, even though we got lots of anecdotal results, okay? But with the red light therapy, I still wouldn't have believed anything until I had the light technology back in my hands for some tune-up and doing some improvements. A couple months after I put the first one in to this guy, and wouldn't that be the time I picked up a paperclip and on the ground, and immediately that muscle spasm started. I was in so much pain, and a day or 2 later, while I'm working, I'm thinking, they say about light can do something on the back. I don't know. Can it do anything? I thought, what the heck, I'll try it. And that was my aha moment with PBM. I put it behind my back, one of my powerful lights. I'm going to guess I had about 50 optical watts or close to that in my device. And in about, I probably had a pain level of about 8, screaming at me, hard to concentrate, still working on the computer, self-employed, you can't stop. No paycheck is going to come in unless you keep going. So I tried that. I had that light on my back, and about 20 minutes later, I started moving like this, getting up, standing, bending over. My pain level dropped from 8 to 3, I would say, or 3. It was so incredible after all these years of spending months of trying to rehab my situation, to turn off a muscle spasm that quickly. And now instead of 4 or 5 months, it still happens to me. Within 3 weeks, I was able to fully restore my situation and make the trip to London, England to meet James and the rest of the people there at the PBM 2024. So anyways, that's my journey. That's how I got into PBM. And so for 16 years, I developed first specialized halogen light that would, with liquid filters so that I could remove the far infrared. That's what I worked with. So let me just start. Let's go to Margaret now then. Margaret, do you want to start your presentation, please, and share your screen? Oh, you're muted, Margaret.
There, now you can hear me. Okay, I'll just click there and share that. Can you see my slides and all here, and I'll make them bigger?
Yeah, full screen would be great.
Yeah. So everybody can see them. Thank you. And thanks for asking me to do this. This was a talk we gave at Walt in London, August 23. And it is just a short presentation. It is a case history. But I thought it was so exciting because this 12-year-old boy had been suffering for 5 days from a traumatic brain injury, and I'll give his history. And then one 4-minute treatment with Tom Kerber's helmet all over the head. And the child is 90% better within just like 5 or 10 minutes. They even called me from his office in Hamilton, Ontario, Canada, to say, look at this. And I spoke with the mother and the child, and he was just so coherent. I mean, it was just amazing. So I wanted to share this case. So yes, I'm a research professor at Boston University School of Medicine, and my research there is primarily with LEDs to treat chronic traumatic brain injury. And you just heard the background for Tom Kerber, so that's good. And so here's the case report. 12-year-old boy. He was at church in a church basement with an athletic group or something, and he fell very hard on his head. I'm sure it was the left side, and I'll tell you why in a minute. And then somebody fell on top of him. So he had this concussion, and he did lose consciousness for maybe a minute or so. And they did take him to McMaster University and do CT scans emergently. And they said there was no intracranial hemorrhage. So that was good for us to know eventually. So he went home. I mean, right now there's no pre-treatment for acute TBI as long as there's no bleeding. All right, so he goes home, and he's really suffering quite a bit. And they said, come back and see the neurologist in 2 weeks. And so that's reasonable. That's good. But he had confusion for the event. His poor mother and family, he just every 5 minutes would say, what happened to me? Why does my head hurt? And so on. And they explained, but then within 5 minutes, he would forget. So it went over and over and over. But he had a severe headache. He complained of nausea, vomiting, couldn't focus, couldn't read. And he was very uncomfortable, to say the least. Then his mother had heard about Tom Kerber and the LEDs and so on. And she called up Tom and said, can I bring my son? This is the story. And he said, sure, bring her over. So Tom Kerber did the treatment. I have to this day never met the family. I never met the child or the mother, but I've talked to them on the phone. So on day 5, they arrived at Tom's office, and the child was treated with his helmet. This is what it looks like. It's a little blurry, but there are 10 LEDs on the diagram here. Each is 3 inches in diameter, and I'll show you that in a minute. And so the whole head was going to be treated as it was. And the first minute is only the red LEDs are turned on. Then they're turned off. And then the next 3 minutes, it's near infrared only. And that's explained on the slides in a minute. But after that first treatment, 4-minute treatment, his symptoms were really, really much improved. And he came back 4 or 5 days later for a second treatment, but he really didn't need that. And all of that is on a video on the SunPowerLED.com website. And there's an interview with the mother and the child at the beginning of the second treatment. So as I said, he had a brain CT scan in the emergency room. And I'll just show you 2 slices from that. It was, within, 4 hours after the event had occurred. So this is a coronal view. It's as if you're looking into the front of the head. And actually, this is the left side. So coming forward. So the issue is that on this coronal view, there's no hemorrhage inside the brain, which would be bright white. But you can see this is the cranium, so this is the skull. And it's very important that, okay, yes, they did find basically a bruise or extracranial hematoma outside the cranium. And maybe that's why his head hurt so much. And but there was no bleeding, overt bleeding that we saw on the inside. Now, so that's just the coronal view. And then this is axial, just a horizontal view. This coronal view is like you're slicing through the brain like a loaf of bread or something. So that for those who are not familiar with coronal views. And this is axial view. And you see the same thing. There's no bleeding, obvious bleeding at all inside the cranium, but we have this hematoma here in the left parietal area. So there's starting in at day 5 at Tom Kerber's office, And this is what the helmet looks like when the red LEDs are turned on, and they are turned on separately from the near infrared ones. And the first minute, it's only the red LEDs, wavelength 660, power 2.75 watts. Power density, you can read through it, 68 milliwatts per cm square. Each LED cluster head is 3 inches in diameter or 40 centimeters per cm square. We're going to treat 1 minute, which is 60 seconds. So it's only 3.8 joules per cm square delivered per cluster head. And the total joules to the scalp was 1,520. Now we turn that off and we start over. And we're just going to turn on these near infrared LEDs that are inside these cluster heads. So it's a wavelength of A10, 2.2 watts, power density 55 milliwatts per cm square, same size, 3-inch diameter. It's 180 seconds, so it's 9.9 joules per cm square delivered per cluster head. And the total joules delivered to the scalp, 3,960. And of course, it's painless, non-invasive. Nobody complains about it at all. And those of you who were at Walt in London, we all sat around under the helmet, and we can attest to that it's no pain, and it's very pleasant, actually. So this is some slides on the mechanisms that may have been at play regarding his recovery. And remember, they're treating the whole head, including down the midline. And that's extremely important because you have this venous drainage system, particularly in the sagittal area here. And then you also have, alongside that venous drainage, you have lymphatic drainage. And so after that acute TBI, this is 5 days later, but he wasn't getting any better. There's probably a buildup of these waste products. I mean, it could be beta amyloid from not getting sleep, or who knows. So he's miserable and has not improved. So when our thinking is that when you can put an LED cluster head at the back of the head here, just above the occipital protuberance in the back, you're going to, especially a 3-inch diameter cluster head. These are MedX Health LED cluster heads in the diagram here. These are not Tom Kerber's, but there's just here for showing the actual approach to it all. So you can actually deliver these photons to the venous drainage system and the lymphatic drainage, I think, to promote that. That's a very critical area to put it. So that it's going to drain down from this confluence of sinuses area, and it's eventually going to drain to the jugular veins. And I'm guessing that that's what happened pretty quickly with this 12-year-old boy. Now, in addition to that, there's the issue of something called the emissary veins. But by the way, before I get to those, I want to show you this coronal slice here. It's from special MRI imaging. But where these lymphatic vessels are located, you can see in this particular image that they're in the midline. This is a frontal slice, it's a coronal slice. And I wanted you to see how tiny they are. They are really small. Maybe a millimeter, maybe less. They're in the dura mater. They actually are in there. And, but they are vulnerable. And you can imagine in football players and whatnot that these can get damaged, or in any head trauma. So I just wanted to show you this special imaging for lymphatic vessels. But the other, I think, contributing factor for his very rapid recovery was that the emissary veins were treated. And this is, again, a coronal view here on the left, and you can see emissary vein. And this is the cranium. This is the bone. But the emissary veins protrude outside the bone, and they're on the scalp. They're in the scalp. I'll show you another diagram in a minute. And they're just under the hair follicles. That's how shallow it is, and they're outside. So you can get to them quite easily, I'm sure, and even with red light. I mean, after all, they are growing hair all the time. It's all over the internet, putting red light on your head to grow your hair. So if the emissary veins are just near the hair follicles, we can deliver light there. And so they they're very special. They have no valves, so the blood can slosh sort of back and forth and share. And they go through the cranium quite easily and into the dura mater, and then on down to the arachnoid and pia, and actually can bring blood supply to the surface brain cortex all by themselves. These are just emissary veins. But the issue is they are all over the head. Perfect for Kerber's helmet, because you can get to these emissary veins with even red light, I'm sure. And then, of course, we do treat with near infrared because we want to go deeper. But I think these emissary veins are really very important to consider. And here's a very detailed diagram of the emissary veins I found on the web. So this is, again, a coronal slice coming down, and this probably through the frontal lobes. And the diagram shows that there's a scalp here, all right? And then there's the hairs sticking out, and the hair follicles just at the base of the hairs. So we know we can get red light there. And then just below that, now we're not in the bone. The parietal bone in this particular diagram is down here, this sort of black blotchy area. But you can see that there's emissary veins going out here, and they're just below the hair follicles. And so they are going to penetrate through all the way through the bone and come down, and actually are going to be able to deliver blood to the brain cortex. You can see over here, cerebral cortex. That's the way this diagram is put together. These little black dots in the green background. It's very colorful, but I didn't do it. It's okay. But it's a really efficient way, I think, to deliver the photons into the blood supply. Now, this idea that the emissary veins are important originally was suggested to Anita Saltmarsh and myself by Dr. Mary Dyson, a PhD in London. She's really very famous for her work in wound healing. And she is a review editor for Gray's Anatomy, the big textbook. And so if anybody knows anatomy in our field, it's going to be Mary Dyson. And so if she said the emissary veins are there and they're very important, okay, we'll go for it. And I think she's obviously absolutely right. So they're located up here in the right-hand corner. Their veins are located on the scalp, outside cranium, adjacent to hair follicles, present over entire scalp, because your scalp is everywhere. They have no valves. They extend through the cranium, reach surface brain cortex, and therefore, I think we can treat them with red photons with shallow penetration, maybe only a millimeter, and that can promote vasodilation. And I think that's what happened with this boy. And he's got he's young, he's 12 years old. He doesn't have stiff vessels. They're very, soft and relaxed, and it's easy probably to deliver photons and work with them. So I would like to have James Carroll talk to us later about this, but there are other benefits of delivering red photons to the blood. And one that I think is particularly interesting is that, I don't know how to pronounce his name, Dache or Dach, I don't know how to pronounce that name, but they published a paper in 2019, it's from France, that there are viable mitochondria in the blood, just kind of floating around. And so it's possible that those mitochondria came to the rescue somehow in some of this great improvement that he experienced. So my summary is just that there's vasodilation of lymphatics and venous blood vessels and the emissary veins. And that might explain why, in part, there was like 90% improvement in less than 10 minutes with this 12-year-old boy. And it was good that, of course, he was treated with the red wavelengths as well as the near. So that's my talk. And I wanted to ask James Carroll if he wants to mention anything about the effect of blood, because he has a Novothor bed, which is all red LEDs, and I'm sure that he would be very helpful in helping to explain what's going on. Thank you.
Great. We'll get some questions going very shortly here. I'll just show you some other stuff here that will complement what Margaret has been talking about. One thing is that the depth of penetration that we've been able to see is much deeper depending on the amount of optical power and surface area that we have. So we have, this is the helmet right behind me here, and it's good. So we just do this kind of thing, and it just goes on top of the head, and you have the, well, it's nice when it's turned on. We need a lot of electrical power to run this guy, but okay, we're plugged in. Oh, sorry. There we go. Okay, so there's the 660 nanometer light inside there. You can see it. And we have the 810 nanometer light as well. You can barely see it, but it's there. Let's see. There you can see a little bit of purplish look inside there with the LEDs. So that's what we've been using with different concussions. I think it'd be really cool. I've got a video that it's only a 3-minute video, but I think it'd be pretty cool for you guys to see this. And this is the case that we're talking about, but we've had others as well. I'm going to share my screen right now, and I want to show you too. We were at the PBM 2024 event, and I'll just show you here, share. So we've got a lot of information. Did that come up okay?
It seems like you have to double click.
Oh, okay, sorry. Let's stop share. Oops, well, let's see what I'm doing here. Okay, let's try this again. Okay, let's do this. And did that come up this time?
Not yet.
Okay, maybe it's not like, can you guys see that or not that? That's weird. It's, okay, you don't see any of that.
And now we can.
Okay, all right, so if you go on my website and you look at under research here, and we click down, well, it's a little slow here. Come on. There we go. Okay. Research. And if you scroll all the way down to the bottom of our page, you'll see the PBM 2024 conference. And there's a reason why I'm going there. This was great. Thank you, James, so much for James Carroll for being a major supporter of this event. But I just wanted to show you one thing on here. Let's see if I can, I guess I am full screen right now. But this was, there's Margaret. We also had Dr. Jenny Flora and Dr. Huffer. And what was done was they just successfully published a study. This is the stuff for that Margaret Naeser just showed. And there's a brand new study that was just presented, and you can download it here on using our helmet with a case study of 50 patients, 25 of which were got the light therapy, PBM light therapy, and 25 that didn't. And the 25 that did, I'm going to stop share on this. The 25 that did, they had a successful improvement in it was an opiate addiction and depression, and they just got treatments for 3 minutes of the near infrared only, twice a week. And after 2 months, they had a significant improvement in their outcomes. And they were actually surprised as to how strong the data was to show that the PBM transcranial using the helmet, how much of an effect it had on these 25 individuals. It dropped down to 17 with the light therapy. Some of them were incarcerated along the way, so that's kind of hard to bring them back into the study. I'm going to share another screen here in a moment. Share. Okay, here we go. Share. Okay. I think I'm going to oops. Okay. Let's go to there. Come on. There we go. And I'll just do from current slide. This is the individual that we had that had this.
Hi, Rose. Hi.
Now, can you guys, were you able to hear that?
Yes.
Okay, good. I just want to make sure before I start.
Tyson?
Hello.
So, Tyson, what happened?
Well, I went to like a cadet group, so it's like kind of like you learn skills and stuff. And I fell and hit my head. I got a really bad concussion, so I couldn't really do anything. I couldn't read. If I stood up for too long, I'd get a really bad headache. And we were trying different things like oils and stuff like that. And then my mom's friend recommended this, the red light therapy.
Yeah?
And so we went over here and we tried it, and straight away I felt results after it was done. My headache cleared up like quite a bit, and that day I was able to pick up a book and read, when before I couldn't even read a sentence. I'd get a really
And
bad
when
headache.
did this happen?
Happened I think last week Friday.
Okay,
No,
last week.
he does. It was Thursday that
Thursday, last
so
week
it was a
was
week
Thursday.
ago.
A week
So
ago Thursday.
Yeah,
And-
and he had like severe memory loss. He still doesn't remember
Yeah.
that day at all.
Right?
So I don't know if he'll gain that memory back. But we took him to Mac, and they did a CT scan and that, because he was continuously asking the same questions, like, what happened? Why does my head hurt? And like it was on a reel, like probably every couple of minutes we tell him what happened. He's like, oh, that would be why my head hurts. I don't remember going to cadets.
Yeah.
And then he would ask it all over again, like, how come my head hurts? So like he probably did it hundreds of times. So they did a CT scan and they didn't see anything on the
That's
CT
at
scan.
McMaster University.
Yeah, at McMaster.
Yeah, yeah.
And then he's got to follow up with a neurologist in a few weeks because it was that bad. But
Right.
he's
Did you
like-
have any double vision?
No, not that I remember of that day.
But you couldn't read a book and
No.
you couldn't watch a video or
No, he had to be in a
I
dark
could,
room.
I had to really lie down. If I stood up and tried to move around, I'd get a bad headache. I tried reading a book. I got, I think, a sentence, and then I got a split in the headache again. So
Okay.
Because he really likes reading, so he was hoping to, because he was bored. He gets bored because he was lying around in a dark room listening to audiobooks. But yeah, the minute he started reading it, just
Okay. And so you did a light treatment under the helmet,
yeah,
and that was 1 minute of the bright red and 3 minutes.
of like the one you can't see.
Right, that's the near infrared.
Yeah,
And so 1 minute and 3 minutes, so 4 minutes of treatment.
and it was amazing. Like after the 4 minutes, I could tell straight away my headache was gone. I just overall felt better.
yeah. So you were still tired and stuff. You
Yeah.
didn't read yesterday yet, did you?
No, I didn't read yesterday.
Or you didn't read on the day you got the red light
Yeah.
therapy. Yesterday you started reading.
Yeah, I tried it, and I'm like, hey, I can easily read. I don't get a headache at all.
Well, we
And-
could tell a difference because he was really subdued. Like he's been really, like just hanging out in his room, really quiet and not.
Right.
And now he's like, whoop. So I'm like.
That is
he-
excellent.
He's definitely back in that sense.
And we're going to do just one more final treatment
I'm
here,
gonna do another
probably.
one, yeah, because
And just to make sure that things are covered. But
yeah.
well, thank you.
Okay, I think, stop share. Oh, I didn't want to do that. I clicked the wrong button. Sorry about that, folks. Just give me one more moment. Full screen. And from beginning. So at this point, we've seen several kids with concussions. Come on. So several kids, okay, with concussions improve. There we go. Like this other one in the middle, he was seeing double. And the amazing thing about this was he had a patch on his eye, and with 2 days, like he could not have the patch on. It was such bad double vision. After the first treatment, 2 days later, when he came back in for a second round, he said he didn't have the patch on his eye. And the cool part was he was able to see fairly well. And he did the light treatment, and just before he went in, he said, see over there, I can't make that out. It's kind of it's kind of fuzzy, the far wall. I can't read that. And he did the light therapy, came out, and he says, oh, he says, that's cleared up over there. So we've also seen it with strokes, and really neat with bad slurs of the, and we'll get right away into a couple other items I want to cover. We want to leave room for questions here. This happens to be the fact that LEDs overlapping can make, can really allow for a deeper penetration, and also if you're doing the proper cooling. From current slide, there we go. So we presented the difference between lasers and LEDs. We did, this is a very expensive, I don't know who's seen this out there, but this is a ball that's like 2.5 feet in diameter. And it's it can measure very, very accurately the light levels that come in. So we compared lasers versus LEDs at different wavelengths after going through different tissue. So light that comes in here, doesn't matter the beam profile, whether it's highly culminated laser or it's a very wide angle LED, we can get accurate measurement. So all our devices we've done measurements on, but in this case, this was done at the University of Buffalo. We put our device on top of chicken and pork and compared, and this is just an example quickly of laser at 5 watts of laser versus 5 watts of LED. And other than this anomaly that we had in the front end here, the two track very, very well with just a slight improvement on the laser here over the LED. That's after going through 2¼ inches of chicken. We did chicken, we did pork, we did chicken, pork, and steak. Here is just a quick graph showing the differences between the three wavelengths and using laser versus LEDs. Yep, and just so you know, I'm crazy. You can see the light, this is another probe device that I've made where you can see the penetration. Forget, this is 660 nanometer, and you can see the light going right through my upper palate. And if you zoomed in, you can actually see the light coming out of my optic nerves. Some would think that you need to have a laser to get depth, and I think I've been able to disprove that with some of the ways I've measured things. But here in this case, I've taken a laser on the right-hand side with 3 milliwatts of power, an LED that I tuned way down in light power, compared the two. And the big thing is when you start going into tissue, whether it's laser or LEDs, the tissue is going to scatter the light in all directions. Now, we've also been able to show that 635 nanometer is also possible, and I think that's where I want to leave it. Yeah, let's leave it at that, and then we can have some questions. But I'll just show just one other cool thing. This is just healing. We talked about that, where this kid's swung a pickaxe and cut his tendon right through. They said it was going to be 6 to 9 months to heal. Here's 2 weeks. Here's 3 weeks. This is daily PBM. And the cool part is the next slide, where in 3 weeks' time, you can see the movement that he's got in his foot. And at 4 weeks, you can see him walking. Now, he wasn't supposed to walk for 6 to 9 months. So there we go. That gives you a little bit, I condensed my slides down to nothing. So I do webinars every Tuesday night, and I'm welcoming everybody who wants to join me Tuesday night. Just to click on my website, and we have doctors and researchers and different ones on there and also patient testimonials as well. So I think this is a good point to leave it open for questions. What do you think, Dr. Cassano?
Thank you so much, Tom and Marnie. I mean, it's really exciting to see this data, especially in children. Yeah, I'm opening to questions. If anyone wants to ask a question or make a comment.
Okay, the website is here, www.sunpowerled.com. That's www.sunpowerled.com. I do have on the research page as well, there's a whole pile of cool stuff there, including the one PBM database that was done in the Netherlands. And I'm sorry, I forget the fellow's name. He's fantastic. He compiled 7,500 PBM research studies. And so anybody can search it on if you click on there. Yeah, so there's other research on that page as well.
Tom, can you talk about your possible treatment for prostate problems?
Okay, you did see a probe there, but that's early workings. Right now, you saw the one probe that could go where the sun doesn't shine, Harvey. But what we're looking at is we have been able to have people with benign prostate. There's quite a bit of optical power out of this small device. We've got approximately 5 to 7 watts optical, depending on the wavelength and depending on the model. But you can see there's quite a bit of penetration there, and it's going right through my hand. So that's 660 nanometer. 635, you'd be surprised. 635 goes through bone even. So 660, 635 goes through bone. We've been able to prove that. But I've had fellows that have used this in the perineal area and actually done treatments on a daily basis, and their benign prostate issue. One person has had benign prostate for 15 years and has saw a total reversal of all his symptoms with using the light on a daily basis. My chiropractor said he decided to try it himself. I didn't say anything to him. He says, "You're missing the biggest market." He says, he says, "I can tell you this works for ED." And he says, "I'm really strong these days." And he passed it to one of his friends, and his friend came up with the same results. That's after about a month with daily usage. So thank you, Harvey, for the question.
So I know, James, you were trying to make a comment, and I see Marty had also a question. So James, do you want to go first?
You're answering Marnie's sort of question. Yes, obviously, there is through circulation, apart from PBM actually improving circulation, then it directly affects red blood cells, reducing aggregation, as well as you get enhanced blood flow. And some people claim that it's carrying more oxygen as a result. So that would be one benefit of getting light into blood. And then you get all these white blood cells, lymphocytes and monocytes, and white blood cell derived immune cells and macrophages and dendritic cells and the like being affected by PBM, and the platelets, pericytes, circulating stem cells as well. And when, of course, you're putting light on the head, you've got there's marrow in the cranium as well, and they will release mesenchymal stem cells as well. So there's a lot potential indirect mechanisms, which I think Marnie's alluding to there. Though I do think we need to be a bit careful, because emissary veins implies that they are sort of returning deoxygenated blood. Really, we want to be affecting probably arteries as just as much. Or maybe just affecting venous return, or causes more arterial supply. Maybe that's how it works. So it pulls oxygenated blood with all its goodies in through. Because I don't know if there are such things as emissary arteries, are there? There's just emissary veins is the only thing you ever really hear about.
Right.
So that's what I'm
But
thinking.
they have no valves. They have no valves.
They have no valves.
No valves. They don't have no valves. So the blood sloshes back and forth, it's very free flowing in different directions. And Mary Dyson was very adamant about that. And so I guess that gives it more opportunity to have different, oxygenated, deoxygenated. I don't know.
Yes. Well, that's obviously an interesting state, needs to be better understood. I mean, but when you don't have valves, and you lead to things like when you have poor venous return, you'll end up with edema and things like that. So it's peculiar. It'd be interesting to know how it works then with that. Okay, and for Tom, I know you're using various forms of meat and things, you could do it with the skin on. one of the biggest challenges for light penetration is actual skin reflection. So the reason you see me
Right.
at the moment is light's reflecting off of me, and so you've got to. That's a major. If you're going to try and define light penetration, if you've got to do it with skin on, otherwise
Yes.
you'll
Yeah,
be.
no, that's unfortunate that I couldn't get a cow to jump up on top of my ball. Probably would have crushed it. But
Yeah, but
yeah, I would love. But the closest that James, the closest that I could show is that when you have a laser source like this here, is I've done laser on the top of the skin surface, and yeah, you'll bounce about. What I found is at 45 degrees, you're going to be bouncing about. So if I put the sensor inside my hand, it's a little difficult to do a live demonstration, but if I put the sensor inside my hand, did a light on 45-degree angle, I'll lose about 25-30% of my light would be going through my hand. But usually with my LED stuff, I'm not quite as concerned about losing 25-30% because I've got 100% more optical power coming from the top. So I don't care about losing a little bit of light from the angle of penetration.
I'm
That's
just
one
talking
thing.
from a science point of view. If
Yes,
you've got to
yeah.
quantify things, you have to do it with skin. Otherwise, you
Yes,
can't talk
I'm
about light
totally
penetration.
agreement. So one thing that I've been able to do is I'm starting, like looking at other ways that we can map how much energy is going through. I've done my arm different places, but when you're looking at light penetration, let's say 660, you can see I'm just a small little window on there, but obviously you have some power coming through all that tissue through my hand and everything. And then if I went to this case, it's the 1050 nanometer, I have a much higher level of light coming through at the 1050. And I didn't change my calibration on the Thor here, but this device, obviously, you have to calibrate for every wavelength that you use. I also have the other, for those that are wondering, I have that ball and I connect it to this would be the easiest way because I don't have a slide up for it. But I have, so I can look at all the optical power dense, like your beam profile on whatever wavelength up to approximately 1100 nanometer. So I can measure out pretty accurately what power levels I'm looking at and what I'm getting. Nothing new to you, James, but to
Well, I was going to
up.
say, I'm familiar with I've been shining light through my hand for 37 years.
Yeah. Yeah. Now, see, that's the problem. When I started 15 years ago, there were people that said, no, light can only penetrate a couple millimeters. And I'm like, no way, not if you have enough. There's two areas, three, your wavelength, right? Another one is your area, the beam profile, how big the area is, and also the optical power that you have behind it over that area and how even the illumination is. And they were telling us right in the beginning, there's no way you could treat breast cancer with our light. And we did, and we were able to see cases. We've got some cases on one of my websites of what was approved by the government to actually do individualized cases. But in order to treat breast cancer, you'd need to have enough optical power to go into the tumor and photoactivate the compound or the drug. So
I think Paolo had some other people who were lining up to ask a question.
Okay, all right, go for it.
So we
got
a minute each.
Yeah,
right.
time is up. Yeah, so someone is asking specifically about your experience with Parkinson and Marty. Before we go into that, I don't know if you had any additional comments.
I can just say that we are just starting a 3-person Parkinson. It's a first-time case study, so I'll know how that works. But we have been able to see Lewy body dementia tremendously improve on an individual that was in his 80s, and he was in real rough shape, and he at least improved about 3 years of his life. His wife he needed 24/7 care. So, and now he doesn't. He sleeps normal like a normal baby, anybody that doesn't have Lewy body dementia. Any other questions?
Yeah, no, I don't see. Oh, I'm sorry.
Okay, I'll just mention strokes. We've had with this helmet, we've been able to see a couple people amazingly have just with the treatment, they're slurring speech one day, you can barely understand them. One treatment, the next day, clear speech. So I've seen that in 2 cases now. One was 2 months after the stroke, the other one was 20 years after the stroke.
I see Marnie has her hands up. 1 minute.
Yes, very quickly regarding the reason I really went back to the emissary veins is because there is, I also do acupuncture research, as you know, and there is a special technique in Japan called Yamamoto new scalp acupuncture. Okay, fine. And the issue is with that particular scalp needling technique, and it's very fine needles, you must keep the needle just under the skin. Do not touch the bone, not the periosteum. And therefore, I have seen unbelievable immediate change in stroke patients also, just with the scalp needle very shallow. So my thinking is that when this happens really fast, they have tapped into the emissary veins because that's what's really near the surface. And I saw a stroke patient treated by Dr. Yamamoto in Vienna, Austria, and he had this paralysis and his elbows down here. And then Dr. Yamamoto, you treat with a scalp needle, you can treat the ipsilateral side. Anyways, that's that system. But immediately he could get his elbow up. The shoulder abduction was just unbelievable. So he went from down here to up here, within 10 minutes. And that's the thing we saw with the child too. So putting those 2 systems together, I said, whoa, this is something going on, at least in part, outside of the cranial bone in the scalp area itself. So that was that. Thanks.
Thank you, Marnie. Thank you, Tom. I mean, there's been quite an interesting discussion and very, very promising results. Again, I'm amazed about the data in children, of course. Thank you all. To be continued. Take care.
Thank you.
Bye.